Hello everyone. Among numerous mental health disorders, today I will be talking about anxiety disorder. So, every one of us become anxious, fearful and get worried in our daily life, and it's normal part of human being. For example, getting worried about our job interviews, examination and the feeling of butterflies in your stomach before any public performance or attending a big meeting. But this becomes problematic when this worry and fear is persistent and is out of proportion to the actual danger posed by the specific object or situation and to the socio-cultural context. For example, you have non-stop and continuous anxiety of going to social situations, and that result in you avoiding that particular social situation. There are many types of anxiety disorder, and the two common anxiety disorder existing in the country are panic disorder and social anxiety disorder, which is also known as social phobia. In panic disorder, a person experiences recurrent or repeated unexpected panic attacks. Panic attack is an abrupt or sudden surge of intense fear or discomfort that reaches a peak within minutes and is accompanied by physiological and psychological symptoms, which consist of at least 6 of the any following symptoms, such as palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking in the body, sensations of shortness of breath, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or fainting, feeling of unreality known as derealization, or being detached from oneself known as depersonalization, fear of losing control or going crazy, fear of dying, numbness or tingling sensations, chills or hot flashes in the body. And at least one of the attacks has been followed for 1 month or more with one or both of the following symptoms, such as persistent concern or worry about additional panic attacks or their consequences, like losing control, having heart attack, or like going crazy. A significant maladaptive change in behavior related to the attacks, like behavior designed to avoid having panic attacks, such as avoidance of exercise or unfamiliar situations. In social anxiety disorder, there is marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others, such as having a conversation, meeting unfamiliar people, eating or drinking in public places, performing in front of others like giving a speech. The individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated, which will be humiliating or embarrassing themselves, which in turn will lead to rejection or offended by others. The social situation almost always provokes fear or anxiety. The social situations are avoided or endured with intense fear or anxiety. The fear or anxiety is out of proportion to the actual threat posed by the social situation and to the socio-cultural context. The fear, anxiety, and avoidance are persistent, typically lasting for 6 months or more. In both the above-mentioned disorders, the fear, anxiety, and avoidance cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The anxiety and fear are not attributable to physiological effects of substance such as drugs and medication, other medical conditions, and symptoms of other mental disorders. Some of the risks and prognostic factors for anxiety disorder are: in biological factor, there is imbalance in neurotransmitters, especially decreased inhibition by GABA-aminobutyric acid. There is risk of developing anxiety for children of parents with anxiety. Stressful events such as stress at the workplace, loss of loved ones, or troubled relationships and traumatic life situations can also trigger symptoms of anxiety. Health issues such as thyroid problems, asthma, diabetes, or heart disease can also cause anxiety. And most importantly, anxiety disorder can also co-occur with depression and other mental health conditions. For instance, someone who has been suffering from depression for a long period may start to underperform at work. This can lead to work-related stress, which can also trigger anxiety in them. Substance use. People who are heavy users of drugs, alcohol, and other substances develop anxiety problems when the effects of substance begin to wear off in the form of withdrawal symptoms. Personality factors. People with certain personality traits such as perfectionists or people who like to be in control, neuroticism, or impulsivity develop anxiety-related issues. Coming to the treatment, anxiety disorders can be overcome, but one must not underestimate the seriousness of the problem. If you suffer from any of the above symptoms, it is best that you seek professional advice and treatment. Anxiety disorders are treated through anxiety medication, counseling, or a combination of both. If you have a family member or a friend who is suffering from anxiety disorders, your support can go a long way in reducing their distress. As with any sort of illness, the first thing you should do is to learn about the sufferer's problem so that you can empathize with their condition. Dealing with people suffering from anxiety disorder requires a lot of patience, but they also need to be pushed and encouraged from time to time to face their stressors or fears so that they may overcome these fears. It is essential that you find the right balance for this. There are many skills which you can learn in order to manage your anxiety. Positive thinking, stress management, leading a healthy lifestyle, and relaxation are some of the common techniques that people use. Trying to manage your anxiety by yourself can be challenging, especially if you are experiencing a lot of discomfort and uneasiness. So, it is always a good idea to reach out for professional advice in such cases. Thank you for listening, and Kadinchela.